there are different ways that the vascular regulation, vascular blood vessels of the brain interact with Alzheimer's disease. So one is the fact that the proteins, which are thought to be peptides, protein, which are thought to be the pathogenic factors in Alzheimer, namely A-beta, APP, A-beta, and tau, also have effect on blood vessels in addition to having effect on neurons. So, which means that part of the way these pathogenic factors, lead to the disease is also perhaps through their effect on blood vessels. In which case, the brain will be hit from two sides. On one hand, you have the direct neuronal effects of these agents, which compromise synaptic function, so the ability of neurons to kind of connect and talk to each other. And at the same time, you have a context in which the blood vessels are unable to provide the blood and the oxygen and the glucose and to clear the waste that the brain generates during the activity. So this kind of convergence of vascular and neuronal effects would kind of result in the disease process itself. So that's kind of one aspect, all right? The other aspect is that in what we call on clinical grounds, Alzheimer's disease. What do I mean clinical grounds? As you can tell in someone who's alive, all right? If we look at people who are diagnosed with Alzheimer's on clinical grounds and then look at their brains after death, you will see that the vascular abnormalities are always an integral part of the dementia diagnosis, pathological dementia diagnosis. Right? So you have on clinical grounds someone who's said to have Alzheimer's disease, so you think only of plaques and tangles, all right? But when that person dies and you look at the brain, you see also blood vessels abnormalities. So in addition, therefore, to having these plaques and tangles, altering the brain, you also have this vascular factor superimposed on the plaques and tangles. So now some people say that this interaction between the plaques and tangles and the vasculature and vascular damage is synergistic, which means, 1 + 1 = 4, all right? So amplifies the damage. Other they thinks that is additive, so 1 + 1 = 2. But in any case, it's best not to have it, not to have the vascular damage on top of that, because you're going to be better off no matter what. So that's kind of the two contexts in which you can say the vasculature has an impact on Alzheimer's disease.